Hello and welcome to eMediCore Patients Corner series. Today's discussion is on transrectal ultrasound TRUS guided biopsy of prostate. TRUS guided biopsy of the prostate is currently the most common prostate biopsy method. It is usually recommended when you have an elevated PSA, prostate specific antigen blood test, an abnormal digital rectal examination DRE of the prostate, or both an elevated PSA and an abnormal DRE. In this method, the doctor inserts a small ultrasound probe into the rectum to guide placement of a special biopsy needle for taking samples of the prostate. The procedure usually takes about 20 minutes in your urologist's office under local anesthesia. Sedation or pain medication may also be given. The risk of TRUS guided biopsy may include, but are not limited to, the following. Bleeding. It is common to see blood in the urine, stool, and semen. However, severe bleeding is rare. Infection. It is rare but may include sepsis, a severe infection with bacteria in the bloodstream that may require further treatment and hospitalization. Pain may also occur during and after the biopsy. However, local anesthesia will usually provide comfort during and after the procedure. Urinary retention, or the inability to urinate, also occurs rarely. TRUS guided biopsy of the prostate allows the doctor to identify cancer in the prostate. If there is cancer, the doctor will be able to know the grade or aggressiveness of the cancer. Alternatives to TRUS guided biopsy include, but are not limited to, the following. Not having the procedure performed. Biopsy using other methods such as transperineal approach, which is the approach of using a biopsy with a needle through the skin between the scrotum and the anus. MRI, or magnetic resonance imaging, with ultrasound fusion method. This method allows the MRI imaging information combined with ultrasound technology to guide the biopsy of the prostate. You should let your doctor know of any and all allergies and medications that you are currently taking, including over-the-counter medications such as aspirin, ibuprofen, naproxen, blood thinners. You should ask your doctor when you should stop blood thinners before the operation. You should take antibiotics before the procedure, as prescribed by your doctor. You should use a fleet enema, a medication to be instilled into your rectum to increase bowel movement and cleanse the rectum, as directed by your doctor, usually a few hours before the procedure. Normally, when the procedure is performed under local anesthesia, you can have a light breakfast and/or light lunch. It is usually recommended that you have someone drive you to and from the procedure. You should use the bathroom just prior to the procedure, since the ultrasound probe may increase the urge of urination. You will be asked to undress from the waist down and lie on your side with your knees toward your chest, similar to curling up like a ball. Your doctor will routinely provide numbing gel into the rectum. The doctor will then insert the ultrasound probe into the rectum and scan the prostate on a video monitor to determine the volume of the prostate and to detect any areas of abnormalities. You will be given local anesthesia to the prostate area to provide comfort during the biopsy. The doctor will then use a spring-loaded biopsy needle to perform routinely around 8 to 12 biopsies or more. The biopsy tissue is small and about the size of a mosquito larva. It will be sent to a pathologist, a doctor who specializes in looking at these samples under microscopes to determine if it is cancerous. It usually takes about 1 week to receive the results. After a TRUS guided biopsy of prostate procedure, you should go home and rest. You should also drink plenty of water and take the prescribed antibiotics. For about 7 days after your procedure, you should avoid strenuous activity, including sexual activity, sitting for an extended period of time, and exercises that include jogging and lifting. You may expect some burning sensations with urination which may last up to 3 days. You may also expect frequent urination that may improve with time and last up to 3 days. You may also expect blood in the urine. It is normal to see slightly pink-colored urine. You may also expect blood in the stool that may last up to a week, and blood in the semen that may persist up to 6 weeks. Notify your doctor immediately if you have a fever of more than 101 degrees Fahrenheit, shaking chills, or are feeling very sick. Notify your doctor if you cannot urinate, have heavy rectal bleeding with blood clots, have pure bloody stool or persistent bleeding lasting more than 1 week, or have heavy bleeding in the urine with blood clots. eMediCorp, core medical education for everyone,
from everywhere,
forever free.